I'm listening to her heart, and we learned a lot more about her heart murmur. It sounds like a little bit of regurgitation from the aorta. This beautiful girl is Saoirse. We have all fallen in love with her. She's only about 20 years old. She's a level 1 broke to ride. We did a lid margin resection on her 2 or 3 weeks ago in hopes that this would give her more comfort, but she's continuing to show excessive drainage from this eye, and we're not sure why that is. So in order to eliminate the problem, we're gonna do a full enucleation. So last time we did the surgery, all we did was remove just a little tiny strip of skin along both upper and lower lids and suture those together. Today we're gonna remove the globe itself, all of the subconjunctival tissues and glands, and we're gonna suture that closed. Saoirse has a family that's interested in her with 2 little kids. She would be an amazing horse for kids. We did find that she has a grade 1 heart murmur. So we grade heart murmurs on a scale from 1 to 6. 6s are severe, 5s are severe, 3s and ups we're concerned about. A 1, I wouldn't consider insignificant, but it's enough incidental that I feel really comfortable clearing her as a light riding horse for young kids. We did find last time we sedated her that her murmur became more pronounced under anesthesia. It didn't change the grade, it just changed how loudly we could hear it. So Dr. Gina is gonna be our surgeon for today. I'm assisting her, and I'm also gonna be keeping a really close eye on Saoirse's cardiac rate and rhythm under anesthesia to make sure we can learn everything we can. But I'm excited for her. She's such a good girl. I'm excited for her to get a home. Good girl, little poke. Oh man, she's so wonderful for everything.
I am clipping Saoirse's face in preparation for her eye enucleation.
Dr. Gina just performed auriculopalpebral and supraorbital nerve blocks with 50/50 lidocaine bupivacaine, and now she's doing a line block all the way around the eye. And then after that, we're gonna do a retrobulbar nerve block, also with bupivacaine lidocaine. Lidocaine kicks in really quickly, and bupivacaine lasts for 4 to 6 hours. So by combining the two, we have rapid onset numbing and then long duration of numbing. You're a good girl. Sorry, sweetie. She's all right. She's very relaxed. This is a really technically challenging nerve block that Dr. Gina just rocked with very little access. It's definitely PMI pulmonic. Gotta look at differentials for that. There are 3 valves that you can hear on the left side of the horse's heart, and the most common murmur we hear is over mitral valve from mitral valve insufficiency, but this horse's murmur, which is very slight, it has a point of maximum intensity over the pulmonic valve. Not a cardiologist, but we're gonna look up what that means. Dr. Gina has completed a full skin thickness incision about 1 centimeter from the upper lid margin, and she is gently, mostly bluntly dissecting through the tissues underneath the skin, which is a lot of fat and connective tissue. The next layer after that are gonna be those extraocular eye muscles. And Saoirse's doing great, Dr. Gina's doing great. I'm listening to her heart, and we learned a lot more about her heart murmur. It sounds like a little bit of regurgitation from the aorta, which I had to look up, and has a normal life expectancy, normal ability to undergo riding. So that's fantastic for Saoirse. She's 20, so she's not a spring chicken, but we anticipate that she should be able to have a life as a riding horse and be a great kids horse. So really happy about that. The only recommendation is an annual vet exam to listen to that heart to make sure it hasn't changed, and that's something we recommend anyway with any horse of any health or age. So that's really good news. Dr. Gina's perfection in surgical form.
That's not true.
This is a hard surgery because almost everything is by feel and is blunt. So you got to be gentle, but you also have to be really confident. And Dr. Gina is a good combination of those things. I'm usually like squelching through with the fat still in there, and Dr. Gina has this like beautifully visualized. Yes, your patient is very relaxed.
Ooh. There's so much stuff. I think I've cut it all.
Yeah.
But it's must still be attached by something.
Feel what you got attached, and I'm gonna try to. This is it. The eye is about to come out. I mean, bodies were designed to keep our eyeballs in our head, so it's not surprising that there's a lot. No, this is it. Yay! You did perfect!
It's a really tiny eyeball.
It is so small, it's micro-ophthalmic.
There it is, right there. Inside all the schmoo.
Good job.
Dr. Gina successfully removed Saoirse's eye. The surgery went perfectly, and she is now closing the subcuticular layer, and then she's gonna close skin. We had a donor send us some of this product and we loved it, and we ran out, and somebody mentioned that we had run out, and they sent us 4 more big tubs, so thank you so much. We're gonna use it today. This is one of my favorite wound products, and I had never used it before that, so thank you.
I put Surpass on first, and then I put this wonderful medicated wound cream that was donated. So thank you for whoever donated that again, because we really, really love it. So I put the Surpass on first, and then I put this over it because the Surpass is a topical NSAID, so I'm trying to give her some more pain management once the bupivacaine wears off. This is SWAT. So we're gonna put a fly mask on her to try and decrease the amount of activity actually on the surgical site, but hopefully the SWAT will also diminish any kind of enticeness for the flies. It's probably not a word, but I made it up. She just got done having the left eye enucleated, and she did very, very well. She is an awesome patient. We just decided to go in and take it out so that way, whenever she goes to her new home, there's nothing to fiddle with, there's no cleaning or monitoring, it's just ready to go. So she is waking up, and as soon as she is awake enough, she gets to go back out.